This is Bloomberg Businessweek with Carol Massar and Tim Stenovec on Bloomberg Radio.
Regular viewers and listeners know our next guest well. He was a go-to voice for us throughout the pandemic. We turned to him for updates, advice, and so much more. He's a physician and the dean of the Boston University School of Public Health. He's also among the most widely cited scholars when it comes to social sciences, with more than 950 scientific journal articles published. He's the author of a new book, Within Reason, a Liberal Public Health for an Illiberal Time.
We're very pleased to have back with us Dr. Sandro Galea, Dean of the Boston University School of Public Health. He joins us on Zoom from Boston. Dr. Galea, it's good to have you back with us. Congratulations on the book. How are you?
Thank you. I'm well, and it's great to be back here, and thank you for having me on.
Hey, I wanted to know the moment that you realized you needed to write this book. What happened in your life that said, okay, we're coming out of the pandemic, and we need to really re-examine the way that people trust institutions?
Yeah, I think I have been thinking about this book since really the middle of the pandemic. You mentioned that I've been on your show several times in the pandemic. I remember one of the conversations we had was about trust. And I remember you were asking me, how do we get people to trust us? This was at the time when we were having a hard time getting people to get vaccinated. And, I probably gave an answer along the lines of, well, you don't get people to trust you during a pandemic. You get people to trust you before a pandemic, and during a pandemic, it's almost too late. And I think at that time, I started thinking about what is it that we were doing and how were we doing it and how should we be doing it better? Now, I didn't want to write this book during the acute pandemic. I think there's a time to self-reflect and there's a time to act. And I think 2020, 2021, 2022 were times to act. And I think public health acted in by and large admirably and nobly, and that was the moment to do that. Now, when we're exiting the acute phase of the pandemic, I think it's time to reflect. It's time to look back and say, recognizing that we did a lot of things well and recognizing there were a lot of challenges, all of that said, but what is it that we should learn from it? What is it that we should do better?
Well, and we want to ask you what we should learn and move forward with and then do better. But having said that, just one quick look back in terms of the pandemic, what do you see as the biggest failure of public health strategy or policy during that time? What was the biggest success?
Well, I think the biggest success, let me start there, is, look, the COVID pandemic was hopefully the largest public health crisis any of us are going to face in our lifetime. More than 1 million Americans died, 7 million people died around the world. Those are probably underestimates. This was a huge event, right? It resulted in a setback in our life expectancy by about 20 years. So this was a really big event. Now, that event would have been worse were it not for the excellent work of many in public health, were it not for the rapid development of vaccines, were it not for the rapid distribution of vaccines. So I think there's a lot that was done well. And anything I say has to be taken with that context in mind. Now, in terms of what we did not do well, I'm not sure I can answer what is the one thing, but several things come to mind. I think number one, we learned that our approach to communication was limited and limiting. We learned that we had an approach to communication that presupposed that people wanted certainty. And when we tried to do that, when we tried to give certainty, given the rapid changes in the science, it backfired in that we were saying X one day, then Y the next, and that rapidly lost trust. And that came from a place where we were used to communicating by saying to people, trust us, this is the answer. And that clearly no longer works.
That's what I wanted to talk to you about, because I vividly remember times at the beginning of the pandemic where we were advised by Dr. Anthony Fauci, okay, don't wear masks because we need masks or in the Surgeon General, I think it was, Surgeon General at the time under the Trump administration, we don't wear masks. And then the guidance on that changed. Wear a mask. So, well, don't wear cloth masks anymore. Wear N95 masks. And I think there was a sort of a collective exhaustion with changes and also misunderstanding. Right. And I don't think there was also a good understanding of what the scientific method is and the lack of certainty. So how do you rebuild trust after that?
There is science that shows that people can handle uncertainty much more than we give people credit for. And there's science actually shown in the psychological literature that when people are told by experts, this is our best estimate, but we don't really know, people actually trust experts more, not less. So I think there is an approach to greater transparency, greater honesty in our communication, which is different if you think about it than how we had communicated. And, I'm very careful in my book, very careful in my writing. I'm not singling out any individual. I think a lot of people did their very best given what we knew under very difficult circumstances. And I want to be very careful about that. But I do think that we should learn from the moment. Another thing that I point out in the book is we became poor at articulating trade-offs. Dealing with a pandemic is not a one-size-fits-all answer. It is not saying the only thing that matters is a pandemic, because we knew that the pandemic really mattered, but we also knew that more and more people were dying from drug overdose. There are trade-offs in our approaches, and those trade-offs need to be things that we surface and that we are clear in the public conversation that we are choosing approach X, even though we know it has negative consequence. That in balance, we think that's the right approach.
Dr. Galea, how do we do that? When I look at some of the macro trends that are kind of a big overlay over healthcare and the medical world, I think about politics and abortion making us think what's next. What else is going to be kind of somehow get into the political narrative with significant outcomes. I think about presidential candidates, rolling back Obamacare, money in healthcare, private equity buying up hospitals and medical practices. I mean, there's a lot going on that I understand why people are questioning the medical community and maybe healthcare policy at large. So what is the smart debate, the right debate to be having around public health, and how do we move it to a better position?
Well, I suppose my answer is that's in part why I wrote this book, and that's why we're having this conversation, because I think my assumption is that most people, most of the time, are trying very hard to find the right space and to have the right conversation. The other thing that you're hinting at, Carol, is that we're living in very divisive times, right? Mm-hmm. And there are strong partisan forces that are driving absolutist answers on very complex questions. And the subtitle of the book is a bit of a nerdy subtitle about liberal public health for in a liberal time, but it's nerdy by design, because it says we should embrace a plurality of perspectives. We should have the nuance, the wisdom, the sophistication to actually have reasoned debate about really complex issues and not allow ourselves to be swayed into absolutist black or white answers, yes or no answers.
But I would say, I agree, the public narrative, but I also think there's so many issues out there that really should be between a patient and their medical provider that all of a sudden become up for public debate. And I think that provides problems. You know what I mean?
Well, I think the very question about which issues actually should be in the public sphere or not is a question we should be discussing. And I think we should be honest about that we should be discussing.
So it's an interesting question, because I think now I'm asking questions to my doctor about vaccinations for my kids that I would never be asking in the past.
Where in the past you would have said, yes, just do it?
Yeah, there's a typical vaccination schedule. And, in the past, when it came to all vaccines, and now it's and it seemed to get this from other parents too. And you see it in the data, when it comes to the COVID vaccine, even though it's recommended by the CDC, there's a very small percentage of parents who are vaccinating their kids. So it seems like it seems like a lot of people don't think that the authorities have the answer.
I opened the book with an anecdote about a bakery close to where I live, which essentially had a sign on the door after mask mandates had been lifted that said, we know that health experts say mask mandates should be lifted, but we still insist on masking in our store. And I asked the question, before COVID, could you ever imagine a bakery that doesn't have its own medical advisory board putting a sign up on the door saying the health experts say X, but we say Y, right? Mm-hmm. And that speaks a lack of trust. Coming back to vaccines, and then in my introduction, I also used this example, Tim, that you mentioned of vaccinating kids. In this country, we never had a conversation about the benefits and the risks of vaccinating kids around COVID. In European countries, Western European countries, those discussions were had, and they actually took a very different approach to it. So, I feel like this was a piece of our approach, which was a very absolutist approach that said, this is the right answer, trust us, it's going to be fine. And that approach has long tail consequences where now, as you said, people are questioning things that they never questioned before.
Dr. Galea, let's continue this in the future because I think it's a really important conversation. Dean of the Boston University School of Public Health, thank you so much. Check out his new book. This is Bloomberg.